How is measles, rubeola diagnosed in children? Imagine a child with a high fever, cough, runny nose, and red eyes. A few days later, a distinctive rash appears that starts on the face and spreads downward. This pattern is typical of measles. To confirm if a child has measles, doctors look for specific signs and symptoms. One key feature is the presence of Koplik spots, which are tiny white spots with bluish centers inside the mouth on the inner cheeks. These spots usually appear a day or two before the rash and are considered a hallmark of measles. Doctors will also ask about the child's vaccination history, especially if they have received the measles vaccine. They will inquire if the child has recently traveled to areas with measles outbreaks or if they have been in contact with someone who has measles. These questions help assess the risk of infection. While clinical signs are very helpful, laboratory tests are essential to confirm the diagnosis. The most common test is serology testing, which looks for measles-specific IgM antibodies in a blood sample. These antibodies usually appear shortly after the rash develops, indicating a recent or current infection. Another important test is the real-time reverse transcription polymerase chain reaction, or RT-PCR. This test detects measles virus RNA in samples taken from the child's nose or throat, which is the preferred specimen. Urine samples can also be tested, but they are less commonly used. RT-PCR is very sensitive and can identify the virus early in the illness. Because measles is highly contagious, children suspected of having it should be isolated immediately to prevent spreading the virus. Healthcare providers are also required to notify public health authorities to help control outbreaks and protect others. In summary, diagnosing measles in children involves recognizing the typical symptoms like the rash and Koplik spots, evaluating exposure risks, and confirming the infection with laboratory tests such as IgM antibody detection and RT-PCR on respiratory or urine samples. Accurate and early diagnosis helps ensure proper care for the child and supports public health efforts to prevent further spread. Always consult healthcare professionals for personalized advice and testing options.